you recognize them with these kinds of symptoms. One is profuse bleeding or irregular bleeding in terms of menses. And also you can see them as maybe you have painful cramps. And two is due to, of course, bleeding as well. You have the dizziness. Yes, hello, good afternoon, our fellow clients. My name is Dr. Silva. Welcome to yet another episode of Ask Dr. Star. So today we have to talk about a very important issue called fibroids. And I think it is some good time back when fibroids caught some discussion on Twitter with Dr. Solomon. And here I come with some few brief concepts about fibroids. So typically fibroids are smooth muscle cell tumors that affect usually mid reproductive age in females between 30 years and then 50 years. That's typically where we usually see these fibroids. And they are typically non-cancerous tumors. That means that they don't cause cancer, and that plays some advantage to the patient, because if they are not cancerous, then that means they can be easily treatable. So we classify them under two. We have what we call, depending on the management, we have the symptomatic fibroids and non-symptomatic fibroids. Now, the symptomatic fibroids are the fibroids that bring symptoms. Usually, you recognize them with these kinds of symptoms. One is profuse bleeding or irregular bleeding in terms of menses. And also you can see them as maybe you have painful cramps. And two is due to, of course, bleeding as well. You have the dizziness and then general body weakness. So all those are the symptoms of fibroids, of course, coupled with the profuse bleeding that you're having. And two, the non-symptomatic fibroids is that you have these fibroids for a long time, and then you're not getting the symptoms, or you're not getting any symptoms related to these fibroids. And typically they can be managed, and their management depends on several factors. One is the age. Two is how many are they, or how heavy is the bleeding or the symptoms also, and then also the urge for the reproduction. So we usually consider these factors with the management of these symptoms or the management of these fibroids. So one is we consider the reproduction, we consider the age, and also we consider how symptomatic these these fibroids are. So one can be having these fibroids but still has the reproductive, or still has the urge to reproduce, or still wants kids. So we have to make a joint decision on how we are going to treat these fibroids, because very many ways of treating these fibroids. One, we can go medical, we can go surgical, or we can do conservative management. So in the conservative management, that is usually preserved for people who still want reproduction, want to preserve the uterus, want to preserve all that it takes so that this one can have babies. So that means if we were to go in and remove these fibroids, we have to remove these fibroids conserving the uterus. Or if we to go medical, we have to give some drugs that maybe typically will shrink these fibroids, and someone can have reproduction or can have kids. And then if their age, someone has reproduced and he has kids, and the age has already gone, maybe he's around 45 years or he's around 50. Now we weigh the benefit of having these fibroids come out and not causing symptoms vis-a-vis also the reproduction. So if someone has already had their kids, we can make a decision. We say maybe let the uterus come out with all its fibroids, and someone survives without all these symptoms coming back. And two, or we can try to go medical, give you some drugs that will stop the symptoms like the bleeding or the pain, the painful periods and the profuse bleeding. We give you some drugs so that we can have those ones tapered down, and then also you survive with having reproduction intact and having these fibroids also in, until we reach the time whereby we can see how we can remove these fibroids at the appropriate time with reproduction being met. They are very common. That's what you have to know. They are very common. And what brings them up, of course, we have risk factors that can bring these fibroids, but there is no known theory or no known reason why these people have fibroids. It's just an abnormal proliferation or growth of these smooth muscle cells within the uterus, just like any other cell can turn to be abnormal, and then someone gets these fibroids. And typically, like we said, usually the reproductive age between 30 to 50 years. That's where we typically see these fibroids. So be watchful of these symptoms. Usually how we diagnose them is, of course, by doing a scan. You have these symptoms and then they do a scan, and then the scan will surely tell us that you have these fibroids and actually quantify how many fibroids you have inside there. And that will tell us, of course, the course of the management of these fibroids. They are treatable, and having them, one, of course, some people fail to have reproduction or fail to have kids because of the quantity maybe of the fibroids you have, or how extensive they are within your uterus, and people can still continue and have their kids or pregnancy with these fibroids, so they can coexist with the pregnancy, and then you have your kids, and then they are removed at the right time. So the uterus has three layers. We have the myometrium, we have the endometrium, and then we have the perimetrium. So the perimetrium is the outer covering of the uterus. The endometrium is the inner surface of the uterus, usually which undergoes menstruation. And then we have the myometrium, which is the thick muscle that is between the perimetrium and the endometrium. So the fibroids can attack any of those surfaces. So they can be within the uterus. We can call them intracavitary or endometrial fibroids, and then we can have the myometrial fibroids within the muscle itself, and then also the perimetrium outside the uterus. They are just attached. Usually those ones are pedunculated. It comes and attaches, and it has like a tail that attaches it on the uterus. So, but all those, the management depends on how extensive they are, the symptoms that they are bringing, and then they are treated, preserving the reproduction, or also maybe we could add depending on the age. So we encourage all women to be conscious about their health. Always go and they screen you out if you have the symptoms, and then you can get management when the thing is not yet out of hand. Thank you.